Now, this is very commonly asked question, that is, what is functional murmur and how they are separate from the organic murmurs. Now, the basic difference between functional and the organic murmur is the presence of an organic lesion. So, whenever we call it as a functional murmur, there basically the patient does not have any structural abnormality. And whenever we call it as an organic murmur, it means that the patient has some structural fault. So, whenever we are saying that the patient has mitral regurgitation and the patient has pansystolic murmur, it means that the patient has either mitral wall prolapse or mitral wall abnormality that is causing this pansystolic murmur. Whenever we say that the patient has pansystolic murmur because of the VSD, we know or we say that there is a hole or a ventricular septal defect is there. So an organic fault or an organic damage is there which is causing the murmur. But in this functional murmur, there is actually no any damage or no any structural fault. In spite of that, the patient has murmur. So how do we separate between this functional and organic murmur? Now, we have graded these murmurs up to from grade 1 to grade 6, where the grade 6 murmur is very easily audible even without stethoscope. So they are pretty loud. Whereas grade 5 is the murmur which is loud, which is very easily appreciable by stethoscope. And grade 4 is any loud murmur where there is a very good palpable thrill. Now, what is thrill? Thrill is basically a palpable murmur, means you hear with the stethoscope that the patient has a pansystolic murmur, suppose on the mitral area. You put your uh, a fingertip or palm and you can feel that murmur, you can feel that vibration over that mitral area where the murmur is the most prominent. So it is actually a palpable murmur which is called thrill. So whenever the patient has this palpable thrill, so in to call it as thrill, it has to be grade 4. So, these functional murmurs, they are always soft, whereas organic murmurs, they are pretty loud. They can be pretty very, very well loud, and it can be easily heard with the stethoscope. Whereas the functional murmur, it can be slightly difficult to appreciate by the stethoscope. So, in functional murmur, there will not be any thrill, whereas in organic murmur, the thrill can be definitely there, though it is not mandatory, but thrill can be definitely there. So whenever we call it as that the patient has thrill, it is automatically grade 4. So in functional murmur, they are usually never grade 4 or more, because to have a grade 4 murmur, it has to be organic or there has to be some fault, then only the murmur can be that much loud. So the functional murmur are usually less than grade 3. We know that this if the patient has mitral regurgitation, so whenever patient will lie down, automatically there will be more blood into the heart, so that the mitral regurgitation murmur will be increased. The same way, if the patient is lying down, then the definitely MR murmur or left-sided murmur will increase in intensity because more blood will flow into the heart system. So this variation with respiration or postural changes is seen with organic murmurs, whereas this variation will not be seen in functional murmurs. So, right sided murmur, like right sided pulmonary murmurs or the tricuspid regurgitation murmur, will be increased on inspiration, or left sided murmurs like MR murmur, mitral regurgitation murmur, aortic regurgitation murmur, aortic stenosis murmur, they will increase on expiration because heart comes more anterior toward the chest, towards the stethoscope. So there is definitely a variation with the postural change and with the respiration change. This is very typically seen with organic murmurs, whereas it is not seen with functional murmurs. So why do we get this functional murmur then? These are the certain conditions like anemia, pregnancy, hyperthyroidism. These are all hyperdynamic circulation where the blood volume is very, very huge. compared to a normal person. That is the reason why we can see this murmur, though actually that is not a murmur, it is just an exacerbation of normal sounds. Such this can be also seen in sepsis, where there is increased heart rate or increased fluid volume. So this was all about functional murmurs versus organic murmurs. That's for now, and thank you.